So when you pull the brake, it tells the T cell to hold back, stop. Allison was one of the researchers who observed that this molecule works like a brake. You can see that it interferes with the accelerator on the T cell. Now, some research teams started to explore this to treat autoimmunity, but Allison, he had an entirely different idea. He had developed an antibody to CTLA-4, shown in green here. And if you block or release the brake with the green antibody, Allison reasoned, the consequence should be that the T cells are unleashed and become more active, and they should now hopefully attack the cancer cells. This was the hypothesis, and the key experiment was performed in Allison's laboratory at University of California, Berkeley, over the Christmas in 1994. And the results were spectacular. The mice who had been treated with the antibody, the yellow curve, were cured from cancer, while the control mice developed large tumors. This seminal study represents the birth of a new concept for immunotherapy, today often referred to as immune checkpoint inhibition. The brake acts in the checkpoint. Allison was now eager to apply it for benefit of patients. At first, there was only limited interest, but eventually a small biotech company took on the challenge to produce the human antibody, the first step on a long journey. A few years later, the first clinical trials were started, and one comprised 14 patients suffering from metastatic melanoma, a pigmented cancer of the skin. And this picture shows how a metastatic melanoma can present on the patient. Now, he started to treat the patients, and some of them showed striking responses. The tumors shrunk, they could even disappear. Other patients showed a more modest or no response at all. And severe side effects were noted in some patients, but the results were positive enough. And this started a long series of larger trials conducted by clinical colleagues. To cut a long story short, in 2011, the treatment was approved for inoperable metastatic melanoma.